A Home Ministry panel has warned that a third wave of COVID-19 could hit India between September and October. We put this news out yesterday and some of you responded with disbelief or uncertainty. And why wouldn't you? Active cases of COVID-19 are the lowest they have been since March 2021. India's recovery rate is the highest since March 2021. And India reported less than 30,000 new COVID-19 cases for the second consecutive day yesterday. After the second COVID wave, which is still fresh in our minds, these data points feel like India is doing okay. My name is Pallavi Prasad. Let's contextualize this report that is making all the news. Experts from the National Institute of Disaster Management that made up the panel are relying on studies by 40 experts from across India while estimating, number one, a third wave is coming, most likely between September and October. Number two, in the worst case scenario, India may report 5 lakh new cases every day. During this period, this scenario includes low vaccination, everything unlocked, and a new variant which is deadlier and more infectious than the Delta variant, which tore through India in April. In a better than worst case scenario, when the vaccination drive has some momentum and people are adhering to COVID-19 norms, the report says that a third wave could come in October and India might record anywhere between 2 to 3.2 lakh new cases a day. The science is still the same. Till the time we have unvaccinated people who haven't been previously exposed to the virus will transmit and mutate. Only 9% of India is fully vaccinated, and despite a 181% increase in the daily rate of vaccination since May, India is likely to miss the goal of fully vaccinating all adults by the end of this year. At the current rate of 5.4 million doses per day on average, all eligible Indians would be vaccinated only by mid-April 2022. And 33% of India is yet to be exposed to the virus, according to the latest National Sero Survey, which is to say, there are plenty of bodies for the virus to transmit and mutate through still. Add to this the fact that most states have completely reopened and the festive season is around the corner. So for all these reasons and more, the MHA panel concludes that the numbers may look good right now, but things can change quickly. India's R value, the data point that gives you a sense of how fast a pandemic is moving through a population, stood at 0.94 on Monday. The goal is to keep it below 1, and we don't have a very big margin, especially in Kerala, which accounted for a large percentage of India's COVID-19 tally for the past few weeks. Almost all experts agree with the MHA panel that a third wave is coming, though many estimate that it will not be as devastating as the second one. That is, they think that the panel's better than worst case scenario is more likely. So what do we need to do to bend the odds in our favor? Walk to your nearest center and get vaccinated. Urge others to do so. India has 3 approved vaccines that are currently being administered and 3 others that have been approved and will soon be available. Keep travel and social outings to a bare minimum, especially those that involve large groups. Don't go to crowded places and events, especially indoors. Stay properly masked in public and maintain distance from people around you. Wash your hands and listen to science and scientists when they say it's too soon to let our guards down. Before I end, I want to flag one other prediction by the MHA panel. It has said that children are at serious risk when the third wave arrives. Before you worry, this needs to be seen in the right context. There is no data to suggest that children will be more affected than adults or than they were in previous waves. Most children will be asymptomatic if they get infected. A small percentage will have complications. But if the third wave is a big one, then proportionately more children will need serious COVID-19 care the facilities and pediatricians for which India does not have. Additionally, India doesn't have a vaccine for children just yet, which makes them more vulnerable. Zydus Cadilla's vaccine just got approved for children above 12, but it will take a few weeks for its use to begin. I'll stop here for today. If you found this video valuable, please share this video with friends and family as a public service update. We are all in this together. And if you like what we do here at Newsworthy, which is bring you news and analysis without the anxiety, the jargon, and the noise, then do consider making a monetary contribution to support our journalism. The link to contribute is in our bio or in the description, depending on where you're watching this. If you're still with me, thank you so much for your time.